How long should a breastfeeding session last? This is one of the most common questions new mothers ask, and the answer can feel confusing because every baby is different. In this video, we'll talk about what's considered normal, what signs to watch for, and how to know if your baby is feeding well. For most newborns, a breastfeeding session typically lasts anywhere between 15 to 45 minutes. In the early weeks, babies are still learning how to breastfeed efficiently. Their sucking may be slower, and they may pause often to rest. This is completely normal and part of the learning process for both mom and baby. In the first few days after birth, feeding sessions may be shorter but more frequent. Your baby's stomach is very small, and colostrum is produced in small amounts, so frequent feeding helps build your milk supply. As your milk comes in and your baby grows stronger, feeding sessions often become more efficient. Many healthcare professionals recommend allowing your baby to feed from one breast until they naturally release it. This can take around 10 to 20 minutes per breast. This is important because breast milk changes during a feeding session. The milk at the beginning is more watery and helps quench thirst, while the milk toward the end is richer in fat and calories, which helps your baby feel full and gain weight. Some babies are quick and effective feeders and may finish a full feeding in just 10 to 15 minutes total. Others may take longer, especially during growth spurts, cluster feeding periods, or when they are sleepy. Longer feeding sessions do not always mean something is wrong, as long as your baby seems content afterward. Instead of focusing only on the clock, it's more helpful to watch your baby's cues. Signs that a feeding session is going well include steady sucking and swallowing, relaxed hands and body, and your baby releasing the breast on their own. After feeding, your baby should appear calm and satisfied. It's also important to remember that feeding duration can change over time. As babies grow older, usually after a few weeks or months, they often become more efficient and may feed for shorter periods while still getting enough milk. If your breastfeeding sessions are consistently very long, extremely short, or painful, it may be helpful to check your baby's latch or consult a lactation consultant. Issues like shallow latch, tongue tie, or low milk transfer can affect how long feeds last. In conclusion, there is no single, perfect length for a breastfeeding session. Trust your baby, watch for feeding cues, and focus on overall signs of good feeding rather than minutes on a clock. Breastfeeding is a journey, and with time, it usually becomes easier and more natural for both you and your baby.